was worried about how to pronounce it, so I didn't bother to
Especially
say.
because we were talking about names earlier.
Oh, you are listening,
Yes,
right?
sir.
So I am always very conscious because I'm like, no. I have seen situations where I called. Well, it was not me, but somebody called the person's name differently, and the person refused to stand up and say, "No, that's not my name."
Okay.
Some people can be very pissed off about that. So, all right. So, because we do not have time, so you can use this one.
Okay.
Everybody's got summer from Atlantic Star. However, here, the only thing we have is Hamatan at the moment, and that's totally fine because we have been looking forward to it. This is Smooth 98.1. I love music. I love a life. You're very welcome to join this conversation. We are about to start in the soul food segment. We are talking all about dementia, at least the one that we can take in the course of 30 minutes. So from now till 8:30 thereabouts, we will be talking about dementia, the causes, the risk factors, the management, treatment, and everything. And of course, if there is something you'd like to know about dementia, you are welcome to join that conversation. Start on Twitter, use the hashtag breakfastinbed981, and then move further to well, yeah, of course, Facebook. The hashtag still remains smooth981, or rather breakfast in bed 981, and the handle is smooth 981 FM. And then on WhatsApp 0809 444 0981. We are streaming live on YouTube. That means you can quickly go to youtube.com/smooth 981 FM and search for us. Of course, let me see us here in the studio. You can drop your messages in the chat box. I'll read them, I'll take them, and of course, they'll get answered if you are asking a question. I have my guest already in the studio. His name is Chris Abojei. Yes, I made that conscious effort to ask for the correct pronunciation of his name so that I do not murder it. And he is a clinical psychologist, and of course, also he's a consultant psychiatrist. Yes, and the founder, okay, clinical psychologist, and the founder of Psych Aid Consult. Thank you so much for joining me this morning. You are
Thank you.
welcome.
Thank you for having me. It's a pleasure to be here.
All right, so we are talking all about dementia. And again, if you want to join the conversation, you're welcome to call on the line 01-448-9981. And of course, you can send messages to 0809-444-0981. Now, the truth is, I realize that dementia is actually not just one sickness or it's
Mm.
not just one specific disease, but it's actually a group
Yeah.
of linked diseases. So please define that for us.
So just like you said, dementia is not a particular disease. It's a group of symptoms, actually. Usually symptoms that affect memory, symptoms that affect social abilities. I think a better way to look at it is to look at the group of symptoms that affect the person's cognition, and then of course neurological functioning over time, generally. And there are different types of some of these illnesses that could contribute to this over time.
Okay. Now, before we get down properly into this conversation, a good number of people think that dementia is a part of normal aging.
Oh,
Is it?
no, it's not actually. So normal aging is you forget a few things from time to time. That's normal. But when it comes to dementia, it's not a part of normal aging. Statistics actually tells us that in sub-Saharan Africa, about 7.2% of people aged 60 and above would have dementia. So when you look at that percentage, it gets to help you understand that even though it's an alarming figure, it's still not. It doesn't make up the majority of the population, and that helps us understand that it's not part of normal aging.
Okay. And speaking of statistics, actually, it was said that currently more than 55 million people live with dementia worldwide, and over 60% of that number are in low and middle income countries. I wonder why. We definitely will get to that. And then currently, we have nearly 10 million new cases every year. Then it goes further to say that that number is expected to rise to about 78 million in 2030, and then 139 million in 2050. That doesn't sound right. So first, I'm curious, why low and middle income countries?
Well, so there are a number of factors that could be associated with that, and you of course understand that with low and middle income countries, you find out that there are disadvantages in terms of your ability to take yourself, standard of living generally, provisions made for standard of living, the kind of economy you live in. One of the things that you find out is that when people they don't get enough support, medical support, assessment, screening support, and so on. So because symptoms associated with dementia can be managed effectively if identified earlier or can be prevented. And diet is one of the things that you probably would also look at. You don't find that in low and middle income countries they can afford that. They can afford the healthcare. They can afford the lifestyle that would help prevent or avoid some of these illnesses.
Okay, that's very explanatory. All right, then, so let's take a breather, and when we come back, we'll be talking about the symptoms of those groups of, the group symptoms that we think we will talk about whenever we are talking about dementia. This is Smooth 98.1. What's the difference between psychiatrist and psychologist?
What?
What's the difference between psychiatry and psychology?
A psychiatrist, so I think a simple explanation is that psychiatrists will use medication for treatment. Psychologists will use psychotherapy for treatment.
Oh,
Even though some psychiatrists then go ahead to learn how to use medication, but the core difference is that they are medical doctors who are licensed to prescribe medication.
that's
We are
psychiatrist.
psychiatrists,
Yeah.
yes. We are not licensed to prescribe medication, especially in this part of the world. So what we do is we do assessments and we do psychological interventions like psychotherapy and so on.
Ah, that is interesting. I didn't know that. Sometimes I use them interchangeably because I think, oh, they're the same, but they're not.
Yeah, people think we're all shrinks.
All right, we're coming in.
Okay.
Yes. Just closer to your mic.
Okay. Okay.
If you're a fan of all the love songs and all the sweet serenading songs, you definitely have to join Coyote Baker on Soulfully Yours and just enjoy. Make sure that you're not listening to that program alone because I tell you there is a way it gets to you. Right now, you're listening to Smooth 98.1, Love Music, Love Alive, and of course, I almost said, soul food, soul food here on Breakfast in Bed. The conversation is about your health. Today we are talking about dementia, and we started the conversation by defining what dementia is. So let's move over to the symptoms associated with dementia.
So one of the very common symptoms that people notice is significant memory loss, and it's a common symptom of
Yeah.
dementia. So people with dementia begin to forget things, especially old memories. Now this is different from you just forgetting your car keys, or you begin to forget names of people, forget certain things that and could also extend to personality traits or being able to do a particular job or a particular activity. So memory loss is a significant factor that you notice with dementia. I think attention as well, being able to pay attention to certain things, reasoning, judgment is affected as well. You also find out that social abilities, social interaction, of course, when you start to forget certain things about your life, that would definitely affect your social interaction, your relationship with people, and then you can also find that this becomes worrisome to the individual and can then affect other what we call psychosocial factors, like the individual could begin to show mood concerns. So depression could be part of the things that you notice. Agitation could be part of the things that you notice. Imagine if you begin to forget almost everything about yourself. You get really irritated, especially when people are trying to direct you here or direct you there. And so these are some of the things that you notice. But social functions are affected, memory is affected, ability to interact with people is affected, significant memory loss generally. I think that's a significant difference. We need to take note of that significant memory loss, where you're not just forgetting your car keys, but you're forgetting people, you're forgetting names, you're forgetting things about yourself. Say, for example, you had a particular job you used to do, you're forgetting how to do those things. I think those are some of the things that you would notice with dementia.
How do you get to that point? Because I'm sure it doesn't just start in a day. How do you get to that point where you're slowly forgetting yourself?
How do we get there? So it degenerates over time. And so I think the best thing to take note of is that there are signs, right? There are certain signs that you need to look out for. And many people in this part of the world, like I mentioned earlier, do not do a lot of medical screening and assessments. So they're not even able to pick up these signs when they start to appear, right? When they start to appear. But this thing happens over time. It happens over time. So how do you get there? It's not... Studies have not been able to show us what are the things that you would see, and so I'm getting to that point. We would only say to people that when you begin to notice some of those symptoms, especially for individuals who have pre-existing medical conditions like cardiovascular conditions like high blood pressure, diabetes. Now these are things that should be warning signs, right? We also look out for family history, right? Somebody has a family history of this, a sibling or a parent or a relative. These are warning signs that you should take note of. So doing your screening, doing your mental status examination, for example, will begin to expose you to this. So when you begin, I think for me, the clue is that when you begin to get worried about some of these concerns, like your memory, your interaction with people, your personality, people are beginning to complain that you're no longer the person you used to be. I think those are warning signs for you to go do some check. And of course, prevention, they say, is always better than cure.
You mentioned something, mental status evaluation. You know the way that we have normal medical checkup. Say, for instance, every year you should go for at least one holistic medical checkup, and then you should go check your teeth or your tooth, as the case may be. Do we have something like that for mental health, where you just walk into a mental health institution and say, okay, I need to have myself evaluated?
Yes, so yes, we do. Unfortunately,
That's my first time of hearing it.
Unfortunately, not many people would want to do that. In fact, funny enough, I was speaking to someone yesterday about doing a personality assessment, and they said, I'm okay doing a personality assessment, but I'm not okay doing a psychological evaluation. But the truth is, yes, there are evaluations that could help you predict onset of neurological conditions like the group of dementia, or even other psychological, illnesses like depression and the likes. So there are assessments like that, and I would also use this platform to advocate that this assessment should be part of your general annual physical checks, right? So you go for a physical check, they should also do a mental examination as well.
That's very interesting. I mean, in a country where we're still struggling with even the corrective maintenance when it concerns mental health, and now you're introducing preventive that people should just walk in casually. How do we do it? Because we do not even have the required number of personnel. How many psychologists do we have? How many psychiatrists? How many mental health institutions? How do we go about this?
So I agree with you that so I would say that the demand is much, but the ability to meet the demand is very slim. So when you talk about the numbers, we have less than 250 licensed registered psychiatrists in Nigeria, and even less than 150 licensed psychologists in Nigeria. Exactly. So when you look at that number, you find out that there's a lot of pressure on the professionals. So what I usually ask is for people to do is their own litmus test, right? You do your own litmus test, the before and after. So if, for example, a simple test of journaling your mood, journaling how you feel over time, is a significant test, right? So because the body would keep scores and the body would tell you when things are going wrong. The thing is, we ignore it, or we have this it can happen to me syndrome. So we tell ourselves, it can't happen to me, or it's nothing. Or in some cases, we even over exaggerate these things when they begin to happen. And so unfortunately, we then seek help in the wrong places, right? So I think the most important thing is you being able to know yourself, right? Know what you're used to, know what your normal response would have been, what your memory would have been. I usually remember things, but it looks like I'm forgetting things now. That's a warning sign. That's a warning sign for you to go and check. And I think age also should be a significant warning sign. The older you get, the more you begin to include a lot of this screening into your annual check, and you need to take them seriously.
That's very important. Being aware of yourself and being in tune so that you're able to spot any difference or something that is unusual So now let's move over to the types, different types of dementia, since we've said that they are group. I mean, at
Yeah.
least I was able to know the group body dementia as a result of something that happened to a very popular figure. So let's talk about the types of the dementia and how they present.
Okay, so there are two groups. There's the progressive dementia. Those are the ones that keep on degenerating over time. And I think Alzheimer's disease is like
That's the most common.
it's the most common form of dementia. You talked about the Lewy body. That's also a type of dementia. You have as part of the non-progressive ones, Parkinson's disease is also a type of dementia. You have the vascular dementia as well. So there's a list of this, but the key thing is to help us understand that some of them, progress over time. Some of them, just happen. You just find yourself, maybe as a result of a traumatic brain injury. So, for example, those who are soldiers, for example, are likely to have that traumatic brain injury begin to hit your head, or even somebody who's had an accident or accidents over time. Boxers, and I'm sure some of us can relate with some of the popular boxers who have had something relating to this. But yes, Alzheimer's is the most common of this. Now, what you find out that some of these illnesses also would affect organs as well, functioning of the organs. Because, so take for example, in the case of dementia, you find out that it's mostly genetic. So there are a group of 3 genes that are affected, and so you're likely going to be able to predict if there's a family member who has had it over time. In the case of Parkinson's disease, you probably would find, like I said, brain injuries, trauma over time, and even genetic as well as predictors. So again, I think it's important that we're able to take note of these predicting factors in identifying, our predisposition and what to do.
Sometimes when we're talking about these non-modifiable factors, risk factors, and family genetics comes up, I just shake my head. I mean, a child has no idea. He's just coming into the world, and before you know it, he picks up something that is already in the family, something that happened to the father, the mother, and I think it's unfair sometimes.
Well, so the thing about genetic factors is that we all carry some of these predisposing genetic factors, and that's why we need to be deliberate about our health. So, for example, personally, I have made a decision not to do certain things. Not because they are bad, not because I don't like them, but because I've seen some genetic traits. So it's important that we become aware of this first. In Africa, we are fond of attributing these things to spirituality. So if you notice that in a family, some people begin to have certain symptoms or certain illnesses, we're likely going to say that it's a familiar cause or something, family cause or something like that. And so we spend our time casting and binding rather than really identifying that these things could have genetic roots. The good thing is that many of these things can be prevented, right? And that's the good thing. They can be prevented and also managed effectively. And so early detection will help us do that.
Yeah, and I think what I will say also is that you, as a person, you should live your life consciously, not just don't just live in the moment and throw caution to the wind because it's all about you. Think about your generation and the people that you're handing over your genes to, right? And so you're transferring things to their life, so at least be careful. So please live life very consciously and deliberately. So let's talk about some risk factors that are linked. While you were talking about the trauma, the brain trauma, and all that, I could not help but think of footballers. They are constantly heading and nodding ball, and it worries me that is there a possibility this thing could have a later in life effect. For instance, is being a footballer, nodding ball, and all of that over time, can it be a risk factor for dementia?
So I think the first thing that I will need to state, so that the listener doesn't get scared in case they are footballers and say, oh, am I going to have this? Is that when we talk about risk factors, it doesn't necessarily mean that if you're exposed to this, you're going to definitely have it, right? It only says that it increases the risk, right? So, and so, yes, maybe nodding ball could increase the risk, but there's no statistics to tell you how many balls you need to nod over a period of time to have dementia. Also, just like boxers, we've seen a lot of boxers, some boxers grow old without having some of those symptoms, and we've seen some of them really have them. So, but we can only say that these are risk factors. You need to take note of them and then, of course, manage them effectively. So I think one significant risk factor is genetics, right? Another would be smoking. Substance use is a significant risk factor. Brain injury, traumatic brain injury is a significant factor. reduce brain activity over time. And so in those days, you'll find that some people retire and then they go back to the village, and in a couple of months later or years later, they begin to show symptoms like this, and then we'd say, that wicked stepmother in the village has done it. So people started getting scared of going back home, going back to the villages. But the truth is, you see, maybe this person before going back to the village was active, significantly active. And so when they retired, they probably went back and just sit down every morning doing nothing. That is a risk factor. That increases the tendency of developing dementia or dementia-like symptoms. And so inactivity is one of them. Lifestyle, diet is a significant one. History of Down syndrome. These are risk factors that you're likely. So studies have shown that those with Down syndrome have a higher percentage of experiencing dementia or dementia-like symptoms. So I think these are significant factors that we need to like. Lifestyle makes a lot significant factor here. Your lifestyle, smoking, drinking, these are significant factors.
At any time I am having a conversation here on soul food, I like to tailor it down to Lagos lifestyle. And I'm thinking air pollution.
Yes.
It is terrible here in Lagos. And yes, I'm guessing that also contributes, and not to forget sleep.
Yeah, poor sleep, exactly. And also the history of a mental health condition. History of a mental health condition could also, maybe like schizophrenia, chronic depression over time. Yes, these are factors that could affect this, because when you look at dementia and dementia-like symptoms, what you notice is there are nerve cells that are dying faster than the average. Of course, as we grow older, you find out that the nerve cells begin to die over time. Of course, so we would say to prevent this, you need to start to engage in activities to keep the cells alive. But they will die, of course. The number of cells you had 10 years ago might not be the same right now, but the activities that you engage in are likely to help protect them and keep them alive and slow down that rate. So yes, pollution is a significant factor. Sleep deprivation is a significant factor. Living in Lagos, I think, should be a significant factor. Again, or cities like Lagos, I think that would be better.
Yeah. I think the government should actually be paying us a sort of allowance to pushing the effect of living in Nigeria, not just Lagos.
So maybe that's a study we need to look at, the effect of money in preventing dementia.
Exactly. We'll come back to some of the solutions and the preventive methods for dementia. This is Smooth 98.1. They should totally give us allowance, stress allowance here in Lagos, please. Very few minutes left to the end of the conversation here on Soul Food. We're talking about dementia, and yes, before going on that break, I said that I think we deserve stress allowance here in Lagos. It is very important for our health and, of course, preventive methods. And let's go back to the real preventive methods for dementia. How do you prevent some of this risk factors that we have mentioned?
Okay, so I think there are some risk factors that are within your control as a person, and I think it's important that we identify some of them. We talked about lifestyle generally, diet, sleep, smoking. These are substance use generally. These are, I think, to an extent within our control. So we need to first start with identifying this and making a conscious effort to work on or prevent them. Pre-existing medical conditions also are things that, like high blood pressure and the like, you need to be deliberate about your intervention. What are you doing to prevent this? What are you doing to manage this? So first identify, the risk factors within your control and try to do something about it. And then the next would then be assessment, screening. Prevention, they say, is better than cure, but how do you know if you don't screen? And so we need to deliberately screen for some of those things. So when you go for your annual checks, you should demand that this neurological assessment or mental state examinations are part of your assessment requirements. So prevention. Now, in terms of people who are already developing it, what we can do is we can put in a few measures to, and most of them are, well, I would say psychosocial in nature, behavioral in nature, to help slow down the rate or even make the person's life a lot easier. And that would include educating family members, right? Because studies have shown that family support or social support is a significant factor when it comes to managing dementia. And so many people get worse because the family members don't even understand what's happening, and so they even put a lot of pressure and stress on them. Even the individuals themselves might not even understand, and so many of them are attributing to spiritual causes. And so rather than taking the right step, they are hoping and praying that a spiritual power will take it away. And so education is the most important thing, and of course having a program like this. But we need to be able to, medical professionals need to be able to educate people, especially when you start to look at risk factors like age. When you come into the clinic and you're seeing that age as a risk factor, there's a type of dementia called the reversible dementia. So those are the ones that you can start putting some of these early measures in place, and you'll be able to eventually reverse it. So assessment is important, and like I said, psychosocial interventions like education, educating the victims, educating the family members, and then putting other measures in place. So for example, we could, in behavioral care, we could tell the individual, of course looking at the type of dementia, we can start to ask the individual to document their life. So document your life experiences, document the things you don't want to forget, document all those things. In some cases, depending on the severity, we might also want to help them, remodify their space, where they live in. So maybe putting tags, pictures, because some of them could even forget how to even use the restroom, for example. So in cases like that, you want to put tags there so that when the person goes into the restroom, they can see what is expected to be done in that place. Family members are significant, and I need to overemphasize this actually. They're a significant factor in helping people navigate this experience. Because yes, it's going to come with confusion. It's going to come with a lot of irritation, anger sometimes, and even frustration, mood distress as well. And so if you don't have the right information, if you don't have the right skills to help individuals struggling, it's going to get worse. Also, the advice of constantly engaging yourself, practicing memory, games, exercises, learning something could just be some of the strategies to prevent them. Now, there are a few medications, but again, when it comes to dementia or dementia-like symptoms, the focus usually, apart from medication, brain surgery or interventions, is more behavioral, psychosocial support, where you're teaching and you're modifying space, educating people, and providing them with the skills needed to navigate the problems that the symptoms present. Because, so it's easier to say, oh, what is the effect? Well, I'm forgetting things. So let's put in an intervention to help you remember more. Maybe you have a card that helps you remember people's names. And so when you see somebody, you could just flip through your card and say, I didn't remember. So, or the individual starts to show some lack of oral control, for example. We put in measures to manage those symptoms. And that's why when we started, we said dementia is a group of symptoms. So we can take and isolate the symptoms and deal with the effect of the symptoms to the individual.
That is very exhaustive. And it tells me that I think we need to have a next one this conversation because there is still more we need to talk about. But I'll quickly take some messages as we round this off. On WhatsApp, who says, dementia, we blame our night shifting flying agencies. Some of us here sound of generators even when none is on. We are subconsciously deaf, in my opinion. And then Tosan has a question. She says, good morning, Oluwaseun, and also to the guest. I have a question for your guest. Well, my mom these days keep forgetting stuff. When she puts stuff on the gas, she tends to forget the most times. If I'm around, I will have to put on the gas. A lot of the time, she burns stuff these days. When you and her discuss about something and you talk to her about it again, after an hour, she will tell you she has forgotten whoever had the discussion. All I want to ask is, might it be that she has dementia symptoms?
So there's no way to really know, except she goes for an evaluation. I think that, yes, of course, the symptoms are almost consistent, but it's important that we, go for an evaluation and find out why. Also, identifying our age is also very important. Yeah, like I said, age is a significant factor. Sometimes this could even be the result of a psychological distress. So people with depression, for example, could even forget things. Put something on fire and forget it. People with anxiety, for example, could show some of those symptoms. But the most important thing is go for a proper evaluation, and don't get so scared until you get the evaluation done.
I would have loved to continue this conversation so that we'll just dig deep and enlighten people, but we are out of time. Now, if people want to keep up with this conversation with you on social media, ask you one or two questions, how can we do that?
Some on social media and Twitter and Twitter, yes, Twitter.
Yeah, Twitter, you can say that boldly.
Twitter and Instagram at Chris Abojei. That's CHRISABOJE. Chris Abojei.
Yes, that's it. And of course, you can also ask some of the questions, and let's continue this conversation using the hashtag Breakfast in Bed 98 tag Smooth 92 FM. Of course, you can also tag at Chris Abojei. That's ABOJEI. Yeah. Thank you so much for being a part of it, and to every other person who sent in their messages. Yes, I see you, Chris. Maybe we'll think about that. He said we should start space discussion. We'll think about that. But thank you so much. We continue this because in 5 minutes time or maybe 6 minutes time, the kids will join me. So adults can go take a seat. 9 o'clock, then the adults can come back. This is Smooth 98.1. Thank you.
Thanks for having
Thank
me.
you so much. This is very interesting, a bit scary for those who want to grow old and grow ripe. But then again, like you said, that your grandma doesn't necessarily mean that you have to have this.
There's a lot to be scared about, but I think that the approach is take it one step at a time. Identify, assess your self-confidence.
How do you keep the brain active?
So learning is one simple way to do that. Always learning something new. There's one way to keep the brain active. Brain cells are likely to die slower if you're actively engaged by reading, learning something, learning a skill. These are simple ways to do that.
Brilliant. Thank you so much. Thank you. I'll end the YouTube stream now.
And I think I did mention something, spending time with family as well. Very important.